Okay, Dr. Cunningham.
All right. Good afternoon, and thanks for joining us this Sunday afternoon. We wanted to give you all an update on the Parvovirus outbreak in St. Louis County Animal Care and Control Center. This animal shelter is run by St. Louis County Department of Public Health. We're happy to report that great progress has been made, and we're hopeful that we've contained the virus and have prevented it from spreading to the other animals. No new dogs have tested positive since Friday. Thanks to the volunteers and the staff, we have fostered several of the dogs, and we want to give a shout out to our volunteers and to our partner organizations such as the APA and Stray Paws Rescue for taking dogs that so that we don't have so many to care for, and fewer dogs are at risk for contracting this deadly virus. The shelter is not an animal hospital, but through emergency procurement, we've been able to quickly purchase supplies to be able to care for the animals and treat them during this crisis. This includes additional crates to create a shelter in the garage to quarantine some of the animals that have tested positive for the virus. And we've done a deep clean of the facility, and we really appreciate the commitment of our staff and our volunteers to get this open again. I want to say again how much we really appreciate the support of our volunteers. In our Friday update to the media, we said that 19 dogs were humanely euthanized to prevent the spread of the virus, and these dogs had developed symptoms and had tested positive. This was a difficult decision and has taken an emotional toll on our staff. With the virus quickly spreading, the veterinary staff determined that humane euthanasia was necessary to stem the spread of the virus. Their quick action has saved the lives of about 200 other dogs. Treatment of this virus takes time, and it can quickly spread to the other animals. Time is not your friend during an outbreak, and in this case, we would have had a horrible situation on our hands with dozens and dozens of other animals sick. I want to credit Dr. Cunningham and her staff. Outbreaks in shelters can happen quickly, and the dogs are often in close quarters, and by the time a case is confirmed, the virus has already made its way to other animals. Dr. Cunningham has some updates on what's happening in the shelter, and including the next steps, so I'm going to hand the podium over to her and let her make some remarks.
Thank you, Dr. Page. I want to begin by thanking our dedicated staff, volunteers, and rescue partners for their extraordinary commitment during this challenging time. Our community has come together in powerful ways to prioritize the health, safety, and well-being of the animals in our care. I am working with my team to evaluate the next steps of our response to the situation, including ways to identify a clean break area of the shelter to house new intakes in a properly disinfected and isolated area. The first case of parvovirus in our shelter was identified on Saturday, April 19th. Preventive actions to prevent the virus from reaching the rest of our population, including pausing operations at the shelter. At the time of our first positive case, we had more than 200 dogs in our care. Our actions were taken to protect the health of the entire population. Those include deep cleaning protocols to disinfect the environment to prevent the spread, isolation of dogs who tested positive or displayed clinical symptoms to the best of our ability, quarantine the entire shelter with only taking in emergency cases, as well as quarantine of exposed animals. We discussed our canine parvovirus protocols with 2 shelter veterinarians outside of the state. We also utilized best references and evidence-based research as provided by the University of Florida Shelter Medicine Program, UC Davis Shelter Medicine Program, the Association of Shelter Veterinarians Guidelines for Standards of Care in Animal Shelters, and ASPCA Pro Outbreak Flowchart. We also discussed the parvovirus outbreak on the state level with state veterinarians. We iterated best practices, provided PPE, review protocols, and we also provided daily assessment of all dogs and treated all positive clinical cases in isolation with supportive care. As of this morning, there are no new positive parvo cases. Only one parvo positive dog remained in our care. This is a positive indication that our early proactive steps are making a difference. Our shelter population is currently stable, and we remain cautiously optimistic that our actions have helped to slow the spread of parvo in our shelter. Getting our healthy dogs out of the shelter is the best way to prevent this virus from spreading further throughout the facility. In the last week, 32 animals were transferred out of the shelter to help prevent the spread of the virus. We currently have 185 dogs remaining in our care. Any area rescues who have space and means to take our healthy dogs, we urge you to reach out. We are immensely grateful to our rescue partners who have already stepped up to help move most of the dogs. Their partnerships are invaluable. They also provided supplies like dog crates and parvo vaccinations as well as tests. And some of these partners are APA, Stray Paws Rescue, Helping Strays, Friends of Rescue Animals, Stray Rescue, and the Humane Society. We also send a special thank you to Stray Paws Rescue, with whom we met to discuss concerns and future steps about a mishap. Their continued support and care for animals in our region is deeply appreciated, and their partnership is invaluable. We are also deeply grateful for all of our volunteers. They immediately stepped up to assist, offering to host fundraisers, offering to come in to help with cleaning. Just yesterday, our volunteers and staff deep cleaned our kennels. Our volunteers also helped to bathe multiple dogs to help prevent the spread. They also assisted with cleaning other areas of the shelter as well. I am forever grateful for their support, care, and dedication. And lastly, I would like to thank our staff. Some of our staff stepped up to foster some of the puppies in our care. I thank our veterinarian clinical team for taking swift and proactive actions. I also want to thank our rescue coordinator with sending over 100 emails on a regular basis to nearby rescues to assist with coordinated transfers. And I also thank our ACO teams for continuing to care for the animals and also assisting with the cleaning. While this has been a difficult time, we remain deeply committed to learning, adapting, and growing from this experience. As we learn from our first experience with the spread of parvovirus, I will be conducting an internal review to identify and reevaluate any potential issues with internal systems or processes. Together with our team, volunteers, rescue partners, and community, we are focused on healing, rebuilding, and ensuring a healthier, safer future for every animal that comes through our doors. With that, thank you.
Sure. Be glad to take any questions.
Might be more for Dr. Cunningham.
Okay.
I want to know more about this influenza problem. What are some of the early stages of it?
Correct. So when a dog come in for intake, some of the signs and symptoms you may see is fever, diarrhea, vomiting, nausea, as well as lethargy, dehydration, shock. That's why it's important to evaluate and monitor the dogs on a regular basis, because their clinical symptoms can change and they can decline very quickly. Parvovirus is very contagious, and that's why it's important to be able to isolate as well as quarantine all dogs.
And how moving forward are you planning to prevent the spread further?
Yeah, so we're currently looking at internal reviews and processes as well. One thing that we've done, we've utilized the garage space as an isolation area. Going through this process, it definitely identified that we need to make some changes in this shelter. We didn't have proper spacing for isolation and quarantine, so the staff quickly made a decision to utilize open space. We had to quickly purchase cages. We also had cages donated to us. So I think this was a lesson learned, that as we go through outbreaks, making sure that we have the proper space to be able to isolate and quarantine. Because as we're running an animal shelter, we can't prevent outbreaks, but we can do what we can to make sure we have the appropriate spacing and resources available.
And just sorry, is it testing wise? How are you going to do that moving forward?
Yeah, so with testing, first thing is animals come into our care, getting them vaccinated is one known way to make sure we can prevent this. We do have access to testing. We will continue to test and retest as needed and make sure we keep, appropriate supplies on stock as well.
This is a question for either of you, but I know there was a similar was happening about 2-3 years ago?
No, this is quite a bit worse than what happened a couple of years ago. I don't remember the details of that. I think that might have been before Dr. Cunningham's time, but I can tell you that this is the worst outbreak of parvovirus that we've had in the history of St. Louis County. It is catastrophic. We have to move quickly to try and contain it, and our folks are really scrambling to create a hospital-like scenario in a place that's never had a hospital, and to treat these folks. Within 48 hours, we had purchased emergency supplies and had our veterinarians scrambling to try and take care of these folks to contain the spread of the virus and keep it from spreading to the other animals. But we've never seen anything like this before.
And then if you could talk more about the goal with the remaining dogs, are you looking to have them all taken up by another shelter for the time being?
No, so we're actually trying to utilize our rescue partners. If we have community members that could be available for adoption, continuing to use our foster program. One thing I will say, we are currently evaluating. We're not ready to fully reopen just yet. There's a lot of decisions that we need to make. I want to make sure any dog that is adopted, we need to make sure that we explain to any adopters any potential risk. So there's a lot that we're still discussing before we can fully feel comfortable with moving all the dogs. But definitely our rescue partners, a lot of them have adequate spacing for isolation and quarantine. So we're definitely relying on our partners to step in and assist us. And for healthy dogs as well, being able to get them to local rescues also.
I'm sure about the origin, right? Like where this came from, the dog, how did it?
Well, so parvovirus, it does exist in the community. The problem is, when it enters the shelter, when you have a closely contained shelter, and a virus that's really contagious, it can spread pretty quickly. I think if the dog, likely would have been at home, it would have been a completely different situation. But I think for us, it was a lesson learned, being able to go back and track and identify, did this dog come in with parvovirus and spread it, or did it contract it in the shelter? Those are all questions that we're currently reviewing. I think this is a great opportunity that highlighted when these crisis moments come up, that, what are the additional resources and supplies that we need to be successful, but then also revisiting all of our protocols, our SOPs. It's unfortunate that this happened, but I think we learned a lot. And especially as we're trying to move forward with transparency, compassion, there's a lot that we can learn from this so that we don't make the same mistake.
I just want to double back to the symptoms of parvovirus, because it is deadly for puppies, and even adult dogs frequently don't survive. And I want folks to know what to look for, understand the importance of getting your dog vaccinated, all the routine vaccines, including parvovirus. But a dog that is dehydrated will move slowly. That's what we mean when we say lethargy. That means they're moving slowly. They don't get up quickly. They don't run around. They won't be drinking or eating if they're nauseated. These dogs may have diarrhea. They may be confused. But if you have the resources and you can get your dog to a veterinarian, it's important to try to get some IV fluids in them if they're not drinking, and treat that dehydration as best you can. People and animals won't survive very long without water. If they're dehydrated, they can survive for a significant amount of time without food, but they need water, they need hydration, and dogs will drink a lot of water. Parvovirus is a deadly disease, and it moves quickly. It's very, very contagious. So if you believe you have a sick animal, you definitely want to get it away from your other animals, and you want to keep people who are interacting with that animal away from other animals. And get your dogs vaccinated. Thanks.